had my endoscopic, what called upper endoscopy and also colonoscopy in 2015. So in August that same year, when I had my choking problem, I mean, especially when I had breakfast, I eat bread or something, I eat quick. I'm a fast eater, so I eat quick, and then if I take what called concentrated fruit juices, I couldn't swallow and I had to throw out because I couldn't breathe it. It happened to me once in I think early September, and it happened now and then, once a month or twice a month, and there were times I can take water to swallow it down, or there were times that I have to throw out. Then 8th of February 2016, and I was driving and I took the multivitamin pills, which is quite a big one, Centrum, and I got choked, and this time the water doesn't help. I couldn't throw it out because it's hard, so I got stuck in my esophagus. So I went to the hospital to check up, and then in the afternoon they did the endoscopy, and then they found out that the suspect of not normal ulcer. So they sent for a biopsy, and the result came back is suspicious of the esophageal cancer. The lesion is quite deep, but the GI wanted to make sure what stage my staging, so he sent to another GI to do the EUS endoscopic with the ultrasound to make sure how the lesion is going into which layer, and also they confirmed that this is a cancer cell already. So I came back, and then the surgeon said, the GI told me to remove it by surgically remove it. So I planned to remove it, but I found out that other hospitals, they can do only open cut surgeries, which is quite painful and also long time for recovery. So I was searching for a surgeon who can perform with the MIS, minimal invasive surgery. So I came here and I met Dr. Pitulak, and then she said, yes, I have to remove it by surgically remove it. So she recommended me to Dr. Chin Niem, and then so I went to see him. He said yes, it can be done. He said he has done several open cut surgery for the esophageal cancer, but not with the laparoscopic. But I said, okay, I go ahead, and then we scheduled on the 6th of March, and we had the operation, and it went on very well. So now it's 17, so I'm discharging from hospital. So I'm very pleased with the results and all the the services that provide here, and then the operation was, I think, very successful, I think. It's painful, but I think it recovered quite fast, and I'm surprised in 2-3 days I'm walking, and then I start eating, and the operation, the dissection of the stomach and the esophagus is very well. I don't feel pain inside, actually. Inside is quite good, and I can eat well. I have no pain or choking or vomiting after the surgery. So I think it's very good. I would say very good results. Dr. Pitulak, she's a very passionate person. She cares for the patients, and she takes her time, explain in detail how things are done, and she spent a lot of time. No matter how she's busy, she would come and sit down and spend time with me, and really, she's a very loving and caring person. And Dr. Chin Myung also very knowledgeable person. His experiences are remarkable. He knows many things. and then he also care of the patients, you know, really wholeheartedly, and he took all his time, 10 hours, staying with me and fixing me, make sure that I'm 100%, you know, recover. So I think, of course, my staging is now not T1, now T2P, so it's a bit changed, but I think he removed them all, so I'm very confident that it will never come back to me again because of him, because he removed all the bad. I told him that, doctor, you caught all the bad guys already, so I'm fine now. So he's really, they don't have time for themselves even. They spend a lot of time for us to make sure that of our well-being, you know. That's my experience with them. I never heard about esophageal cancer, so I ignore it because it's not painful. You don't feel anything. Sometimes, yes, you may have a heartburn, like a reflux, you know, but it's like normal. And you can eat well for a few years, and you didn't know that you have cancer in you, you know. So I would, like everyone, should study about what are the other cancers that we have to be careful, and I think check up regularly, ask from the professional advice rather than friends, and you know, or some people who call themselves doctors, you know, which they are not. So I think should find a proper professional medical doctors and advice and do regular checkup.